Today we will understand two things, two concepts. The first concept that we will understand is how how type 1 diabetes works. Second concept, we're gonna understand that how the treatment for type 1 diabetes works. Okay, so we have two topics today, topic number 1 and topic number 2. Okay, so we have we have a lot of questions around this topic, right? For example, a woman comes to you with type 1 diabetes and she puts insulin in, right? Now they can ask you, is it phosphorylation or dephosphorylation of glycogen synthase? Well, in last video we discussed about this little fact that we can remove the phosphate from glycogen synthase and glycogen synthase will work. So we will call it dephosphorylation of glycogen or glycogen synthase, right? And you can also remember about GLUT4, right? I mean, these are just scattered facts, honestly, right? Now, let's come back to our topic, right? Let's start with this topic. The first thing that we want to understand is what is type 1 diabetes, right? A lot of people will think that, hey, it's just no insulin. Well, actually, let's start with like the most basic facts. What happened here is that in type 1 diabetes, you have your immune system, right? So immune system goes and destroys your what? Pancreatic beta cells, right? And where are these pancreatic beta cells? They are on the islets of Langerhans, right? We want to know that. Okay, so pancreas, right? Then islets of Langerhans and beta cells and then insulin, right? Now question is, what happens to the beta cells, right? What happens to, so they get destroyed. Okay, then what happens if they get destroyed? What's gonna happen? Well, insulin production is gonna fall. So that's type 1, right? So low insulin, right? Simple stuff right there. So insulin deficiency develops. Now the liver, the muscles, the adipose tissue are all normal. The problem is that hormone is missing, right? Now, why insulin is so important? Well, it lowers glucose, right? That's true. But that's like saying that heart pumps the blood. Correct, but incomplete. So insulin tells the tissue that food has arrived. So insulin tells that food is abundant. That's what insulin tells, exactly. Now, that's what happens, right? Now, what happens if this gets destroyed? What will happen? Well, if this message is destroyed, then on the liver level, right? On the liver level, liver will think that, oh my God, there is no food. Therefore, what will happen? First of all, liver will try to increase the blood sugar in your. The liver will try to increase the blood sugar, right? So it will increase blood glucose, right? And how would the liver do so? It will do so by gluconeogenesis, by making new glucose, by gluconeogenesis, by glycogenolysis, by breaking down glycogen, and by ketogenesis, right? So liver thinks, oh shit, we didn't have a glucose. So these things gonna happen. What will happen at the musculature level? What will happen? Well, without insulin, we have these GLUT, right? GLUT is a transporter that lets the glucose in, right? So GLUT does not efficiently work or move on to the membrane. So GLUT4 especially, okay. So GLUT4 will be immovable, or I should say it will be not functional, right? So it will lead to less uptake of glucose. So if you have less uptake of glucose, what will happen? We're gonna have protein catabolism. Why? Well, we have two reasons for that. First reason is protein catabolism happens because we need ATP to maintain those protein structures, to muscle structures. Second reason the catabolism of protein happens because protein produces a lot of energy that is amazing for whom? For RBCs. So that's why the protein catabolism happen. What about fat? What will happen to the fat? Well, fat without insulin will have first lipolysis, right? So the fat breakdown gonna start, right? So if lipolysis happens, then the blood will be flooded with something called as free fatty acid chains, right? And then these free fatty acid chain can go to liver, and liver can convert them into ketones, right? So that's gonna happen, exactly, right? So a patient injects insulin, right? What's gonna happen? First of all, okay, so let's build it again. So this is how type 1 diabetes works, exactly, okay? Now our patient has injected insulin. Now everything changes. What's the first event? What do you think? Treatment for, so someone puts some insulin, right? So insulin in, okay? Insulin is administered to the patient. What's the first thing that's going to happen? The first thing is going to happen is that insulin binds to the insulin receptor. So insulin binds with its receptor. What is the name of this receptor? From last video we talked about tyrosine kinase demerizes. That's the receptor name, okay? And it's present on the cell wall, right? So it binds with its tyrosine kinase demerizes receptor. That's the receptor name, right? Now this is the receptor, right? The tyrosine kinase. What happens? Well, in this tyrosine kinase receptor, we have two molecules that are inside the membrane. These two molecules what will happen to them? They will dimerize. They will change their shape and they will become one. So tyrosine residue becomes phosphorylated. So tyrosine residue phosphorylated, right? So once it's phosphorylated, the signaling, intracellular signaling will start. So in this signaling, this is a long signaling, okay? A lot of people don't talk about this, but let's talk about it. Let me even write it. So once we have insulin binds to the receptor tyrosine kinase, this one, RTK, we call it RTK simply, right? So we call it RTK, right? That's RTK for you. Receptor tyrosine kinase. So once we have this receptor tyrosine kinase, we make this tyrosine phosphorylation, and once this phosphorylation happens, we have the whole signaling cascade starting. Now the start of this cascade, we start with IRS proteins. So we have IRS proteins. So once these IRS protein, they go and they talk to whom? They talk to PI3K. And then this kinase also phosphorylate and puts this phosphate on PIP3, changes PIP, let me just say, changes PIP2 to PIP, or maybe just let's skip that step, just leads to PIP3. And then we have protein kinase B, or we can say AKT, called protein kinase B, right? The main thing is that eventually we will have, everything will lead to something which is called as protein phosphatase. Phosphatase activation. Okay, so everything will lead to this protein phosphatase. Okay, as you can see in the last video, protein phosphatase actually removes the phosphate from both of these enzymes, the glycogen phosphorylase kinase and the glycogen synthase. Synthase makes the glycogen, and glycogen phosphorylase kinase destroys it, catalyzes it, right? So the main story is that all of this insulin will leads to protein phosphatase. That's the main game. Okay, so that's the main story right there, right? Eventually everything leads towards protein phosphatase. Now, why protein phosphatase, right? I think we already told. Let me just repeat it. Okay, didn't we already learn this, right? I think we learned this, but okay, let me just say it again. Protein phosphatase removes the phosphate group, right? And in fed state it dephosphorylates, right? And it just removes these phosphate group from both of these enzymes, right? Now, which enzyme do you think is the most important enzyme? There are many enzymes affected, right? But which is the most important that explains reduction in the serum glucose? Let's think. Of course. Okay, let's think. First of all, which enzyme? Now the question that comes to us is that which enzyme is the most important when it comes to reduction in blood glucose? Which is the most important enzyme? That's the question right there in front of us, right? Let's talk about it. Okay, first enzyme that we know is called glycogen synthase, right? So what does glycogen synthase do? It converts glucose. We know that it converts glucose into glycogen, right? Now question is this storing glucose or releasing? Is this storing glucose or releasing glucose? It is storing glucose, right? Exactly what insulin wants, right? So during fasting, remember that PKA, this protein kinase A, phosphorylates glycogen synthase, this enzyme, right? So when it phosphorylates glycogen synthase, what happens? It becomes inactive, it stops. So after we give insulin, what happens? The protein phosphatase, this enzyme, right, it becomes active. Now once it becomes active, it goes and it removes the phosphate from this glycogen synthase that was put by Mr. Protein Kinase A. So once this happens, this becomes active. So this becomes active and then starts producing glycogen, right? So glucose becomes glycogen, and then that's how the blood glucose falls. Exactly how it really happens, right? Now, why does this lower the blood glucose, right? Because that's how it happens. Okay, why does it happen? Because we have blood glucose, it goes inside the liver, then we have glucokinase, it traps the glucose, right? Then we have formation of glucose 6-phosphate, right? Now at this glucose 6-phosphate, right, at this point, right, glucose 6-phosphate here, now it has this option of going to glycogen synthase, is option of going to glycolysis and pentose phosphate. Now if we have oxygen and we have these insulin, right, this glucose 6-phosphate can shift into glycogen synthase. That's how it really happens, right? So where did the glucose go? It disappears from blood, right? It's now stored. This is exactly what your insulin exactly wants. Now note that liver right now under glycogen synthesis pathway works as a buffer, not as a competitor, right? So that's exactly how it really happens, right? Now when you think about GLUT4, right, a lot of people will think that, hey, insulin increases GLUT4 and then done, right? Of course it does, but the GLUT4 is true or not? What do you think? Is it the best answer? No, I don't think so, because GLUT4 only explains that glucose entering into muscles and adipose tissue, not that it goes and gets stored into liver. So for glucose to be stored into liver, you need glycogen synthesis. Okay, so that's the story. So the answer, to this question that, hey, how is that blood glucose going down? It's because we have glycogen synthesis and it's happening in the liver. So that's the correct answer, not GLUT4. That's important to know, right? So which glucose transporter, by the way, are present on the liver? The answer is GLUT2. At the liver we have GLUT2. At the muscles and fat, we have GLUT4. Okay. Adipose tissue, GLUT4, right? Liver is GLUT2. That's important. Okay. What else someone can ask you? Suppose the options are GLUT4 translocation, right? And activation of glycogen phosphorylase, deep phosphorylation what do you think? Which the great mechanism? I hope we can understand. The great mechanism here in this whole video, is dephosphorylation of glycogen synthase. That's the thing. And that's how it actually works. Okay.